in general, our goal is to get you back to what you want to do. So things that are lower impact, golf, walking, biking. Within several weeks, people are often back to commencing those things. I'll tell you, go out and putt a little first, chip a little, take a few off the range. Don't go play 18 holes the first time out. But a lot of people are getting back to those kind of things fairly quickly within several weeks. If you're trying to get back to being a roofer, maybe a few months, up and down ladders, and just obviously more vigorous use of the joints. And it's not that I set that in time. It is really just based on when your knee feels okay to do it. And so we talk about it, and we can kind of plan in advance. And I do have some guidelines on when I think you'll get back to sports and fun stuff, and when you can stop thinking about me and your knee. But it is generally going to be that first 2 to 3 months where most people are getting back to what they would consider normal life, doing their desired activities, moving on past sort of the recovery phase of the knee replacement.